What I was saying was, good morning, first of all. We still have about 4 minutes before we start, so maybe I'll use this time for a quick couple of housekeeping requests. This is going to be a 50-minute discussion. It would be nice if you kept your phones on silent so it didn't disrupt the progress of the conversation. At the end of 40 minutes, I'm going to open up to the audience for questions. Same rules of the game as all conferences. Do raise your hand. Do try and keep your question brief so we can make space for as many questions as possible. And so happy to see a full room at 10 a.m. I wasn't expecting it. Okay, almost a minute to the time, so maybe we'll get started. The reason I'm waiting is for our online audience as well, and I hope they get the time to join into this conversation. So good morning and welcome again, and a big welcome to our online audience and viewers. It's great that conversations such as these now have the ability to spread beyond the confines of a room. And I think what we're discussing here is important. And it's important for many regions that perhaps don't have the access to or ability to come and visit a conference like this. So very happy and kudos to the audience, the conference organizers for making that effort. It's a little bit macabre in terms of a topic to kick off at 10 a.m. What we're discussing today is counting the dead, lessons from the pandemic, and what we can draw from that in terms of confronting the climate challenge. Before I introduce my very, very standout panel, I thought I'd take a minute just to contextualize this. I was thinking about it last evening. It sounds like a technical arc, what's happened with COVID, and what's happening with climate change and how do the two connect. And I think most simply put, at its barest form, we're talking about lived experience. I don't think there's anyone in this room and beyond it who wasn't affected by COVID, who didn't see a loved one or a family member or a friend suffer from it. It's common, it hurt, and it was very, very painful while we were in the midst of it. Equally, at this point, I don't think there's anyone in this room who can raise their hands and say they're unaffected by climate change, that they're living through something they haven't seen before, and that they're worried for generations after in terms of what we're really dealing with. I think if we start with that basic premise, it makes the conversation much more real. So let me start by introducing the panel that's going to be discussing all of this and perhaps more today. Sondre Solstad is the Economist senior data journalist. He built the publication's COVID death model, and that's actually been used and widely standardized by many news organizations, also implemented and used by the WHO. And he's going to talk a little bit about the processes that go into really systematizing something when you're living through a period of such intense grief. Bilal Mateen is the clinical technology lead and senior manager for digital tech at the Wellcome Trust. For those of you who are not familiar with their work, they're a global health philanthropy fund. He manages many millions of dollars. And for anyone who's interested in work around health journalism, he's the man to catch after this panel and get some time for a coffee with and get to know what they're doing and what they're interested in. And Amruta Byatnal is the Inclusive Economies Editor at Thomson Reuters Foundation, a new role for her. Before that, she was a journalist and very much at the forefront in terms of documenting what was happening with COVID and what was happening with the number of uncounted deaths, particularly in geographies like India, where I think it was a spectacular clash between systems failing and establishments not always living up to the trust that was expected from them. So let's keep that at the back of our minds as we open up the conversation. Welcome to the three of you. Thank you for joining in. Sondre, let me start with you and let me do a little bit of a rewind perhaps, because it's good to know where we started from to know where we're going. At the point you were in the Economist newsroom and things started really escalating around COVID, where did you get to the point where you thought about, hey, that's not adding up? These numbers are not adding up, and what can we do in a more scientific manner in order to ensure that we're counting the number of dead that we're seeing across geographies?
Thank you very much. Let me first say it's a pleasure to be here. I'm very honored to be on this panel. What I would say is that I remember it very vividly, actually. So this was back in early 2020. I just started at the organization, and we just passed through this wave of cases and deaths in Italy that were being reported in the media, and the next country was Spain. Everyone was talking about Spain. And I remember looking at the numbers and looking at the testing data, and essentially it just didn't add up. It seemed to me that the best way to explain this was not some major outbreak in Spain and nowhere else, but just simply that they were testing better than other countries. At that point, I realized that this would be very different in the reported figures than it would be on the ground, as it were. So that's how it all started. And then a colleague of mine had the idea to look at death tallies. And we started with Italy, and then we gradually expanded to cover those tallies where they were available, but of course they aren't available in most countries, and that's why I had to go into this big effort to try to figure out what happened in these other countries.
So we're looking at a slide that you shared with us earlier. Do you want to talk our audience through?
Yes, sure. So this is actually updated as of last night, I believe, or no, the day before that or something. And what you see on the, I guess it would be the lower left side, is the official COVID-19 death tallies per 100,000 population. And what you see is a world in which the rich world has suffered relatively terribly, whereas a lot of poorer countries have, for whatever reason, done a lot better. Now, in the top right, what you see is what you would get if you tried to estimate what actually happened in these countries in terms of excess deaths. So I'm not sure how much detail you want me to go into, but essentially, we might not have sort of the perfect figures for these countries, but we have a lot of data, and we can use that to estimate what probably happened. And as you can see, a lot of things change. Poorer countries do worse, as you would expect. They don't have resources for testing. And also a range of authoritarian countries do a lot worse because they have an incentive to hide the true numbers. Now, what I would sort of finish by saying is that the problem with using the official figures is that they tend to be misleading in a very nefarious way, which is that you'll end up underestimating the severity of the pandemic in precisely the countries with the least resources to fight it. And of course, that's what I fear will happen with climate change as well.
Yeah, I just have a quick follow-up question, Sondre, before I move to the other panelists, because this is a curious group of native journalists. We only think about what's happening in the newsroom often, and we feel everything so much stronger because of it. When you started doing this and started this process, did you get a lot of reach outs from journalists from other newsrooms and across other countries saying, hey, this is great, how are you doing this? What can we do to sort of contextualize this for where we're reporting from?
There was a fair bit of that, yes. I would say, especially when we started, we focused on the official data that was available in a range of rich countries. And for that, we got a lot of reach out, and a lot of people essentially started using our data. And then when I started this modeling project, which was sort of more of the novelty where we are actually providing the data and being the source for the data ourselves, then I got a lot of reach out, including from the WHO and so on and so forth, and I've been advising them as a result.
Amruta, something different but not quite separate was panning out across the global south. For many of us who were looking at it in the global south, it looked like a train wreck, really, in terms of what was unfolding.
Yes, I think I started first looking at it with just a question, right? And the question was, will we ever know what the true toll of the pandemic will be? And I think it started sort of from the reports that were coming out from Italy, the reports that we were seeing on the ground in India, right, for example. And we had local reporters who would have to go to moratoriums, right, like who had to go literally count the number of dead, physically count the number of dead, because what was being reported by the government agencies was simply not true. It was too low to sort of, reconcile with what we were seeing and what we were experiencing, like you said, in our daily lives.
Yeah.
So I guess that first question led me to then ask many more questions, right? Like, what is happening globally? What are research organizations doing? What is the WHO doing? And at that point, they weren't doing anything. And it was important to ask those high-level questions because it does sort of trickle down to what was happening on the ground. When there is no global data and when there is no global understanding, what it does is it helps countries and governments hide behind that opacity in that sense, right? It helps people say, nobody knows, so it's okay to not know. And I think it's because of those local efforts, and again, like small initiatives that were coming out, thanks to researchers like Ariel Karlinski and Dmitry Kobak, who first started gathering that data, literally going to every small, statistic office from every country and gathering that information, and again, like feeding it to journalists like Sondre. It was then that we started to get a sense of what was happening and to sort of, put that picture together.
Yeah.
This was obviously 2020. 2021 was a lot worse, in the second
many
wave.
countries,
For
yeah.
many countries. And it kind of went from that to knowing what to ask, what questions to ask, and then knowing where to go to look for those answers.
Yeah. What Amruta is not modestly telling you is that she wrote some smashing stories around health at that point. And if anyone in this room or listening to this conversation is a local journalist, please take a moment to really give yourself a pat on the back. I think you are the nodal force of what is driving journalism. Of course, it's about the Economist newsrooms, but it is equally about local journalists who stand in crematoriums and say, hey, the number for this day is 1,500, and I just counted 3,000 bodies that have been cremated, so this doesn't add up. Incredible work at that point, and incredible work that you continue to do. Bilal, it's a good point to segue into climate change. I was reading this really interesting article around the time that COVID happened, and it was a scathing piece in Science, I think, around Donald Trump and his insistence on a vaccine. And I'm quoting from it because it's so good, where they said, you can't insult science when you don't like it, and then suddenly insist on something that science cannot give on demand. Is science pointing to a wholly different picture in terms of climate change and deaths than the one we're looking at or talking about at this point?
It's a wonderful framing. I'm going to steal it.
I'll give it to you on a T-shirt.
I think that's... it's just flashing green. Switch off the mics.
No, you have to switch off the mic. That one.
Sorry.
Switch it off. Sounds like Trump.
No, I think that's exactly the way to frame it. And those of you that have worked recently in the space of climate impacts on human health will be familiar with the WHO's estimate. It's one of the first websites that pops up when you Google climate and health, which suggests that the excess mortality we should expect from climate impacts on human health will be something in the order of 250,000 by 2030. So annually between 2030 and 2050, expect 250,000 excess deaths. Now, that's about 10 years old. And when you put it in the context of what Sondre and Amruta have just been talking about, it's very easy to see climate change as a problem that we'll need to figure out in the next decade, 2 decades. And I think if you take away one thing from today, from what I have to say, it's this is not tomorrow's problem, it's today's. And the numbers that I want to plant in your head so that you can walk away with something when people go, oh, but this is what the WHO says, is that when you look at something like non-optimal temperatures, so people often go to heat waves, extreme events, more people die from what it would be considered normal ambient temperatures, which are non-optimal for human survival, than they do in those extreme events. So non-optimal temperatures, too hot, too cold, is about 5 million deaths a year, excess deaths, right? Solving the problem of climate change isn't just adapting to the fact that the world's getting hotter, it's looking at the root cause, right? We burn fossil fuels, we create pollution. We've increased the estimate of the impact of premature deaths due to pollution. The WHO and IHME number used to be about 6.5, 7 million. In more recent years, we've realized it's a lot worse than we thought. It's probably around 9 million deaths a year, right? This is today's problem, not tomorrow's. And enough people are dying that I think it's very legitimate for us to be on stage and talk about the two in the same breath, because this is a public health crisis and we do need to get our hands around it. The difficulty is when you talk about COVID, you're talking about a pretty singular entity. When you're talking about climate change, you are talking about something that's so heterogeneous that it's sometimes hard to count up all of the individual pieces and see the total magnitude of the impact that we know to exist. And that's what brings me to the slide behind you. Much like Sondre's, where the official reporting for most of Africa was highly discrepant with what you were seeing with excess mortality. This is actually a figure from the paper that gives me that 5 million deaths from non-optimal temperatures. So each of those dots is a location from which temperature and mortality data is provided to arguably one of the most comprehensive studies that is currently available. It's called the multi-country, multi-city collaboration. It is a brilliant piece of work. But what I want you to take away is that most of Africa is missing. In fact, there is one country in Africa from which you are reliably collecting data, and that's South Africa, which is very much a middle-income nation. And when we talk about the impacts of climate change, we expect those impacts to be disproportionately burdened on those that have, one, contributed least to the problem, and are most vulnerable to it for a whole series of other reasons that tie into socioeconomics, demographics, low-income countries. Right? And the fact that we're not counting them, the fact that they're not part of the conversation, means that what we are seeing is the lived experience of people in high-income nations who have the ability to adapt to these problems, not everyone, and definitely not the communities most impacted by it.
Just to buttress that point, I was reading a report by the University of Chicago that pointed to the fact that by 2100, as many people would have died of climate change as they have of cancer and infectious diseases. And to say the fact that because there's a longitudinal sort of element to this, right? One is, of course, talking about people who've died, but the other is talking about people living in extremely poor living conditions that are affecting their health, that are affecting the sort of social and economic fabric of where they live. There's a problem here, which is the same problem that COVID presented, which is that many journalists for whom climate is a beat or who feel strongly about it get it. A lot of philanthropic organizations like yours get it. Sometimes policy does not get it. What is it that you want to see from journalists and newsrooms and organizations that can speak to a problem like this? What is it that you would like to see amplified?
Two things, and this is my ask of all of you. One is intention and the second is context, right? We will talk a lot, I imagine, over the next hour about the fact that a lot of the data that we need is missing. I think over the last 3 years, we have seen this shift. Journalism is no longer separate to research. I see it on this spectrum where what a lot of local journalists are doing is part of the research ecosystem and cycle. We need you as much as you need us. Yeah. And helping platform the fact that there are data gaps, helping be that mouthpiece where I think researchers maybe write great ideas. And
I'm sorry, it warms my heart that you say you need us. It's nice to feel needed as a journalist. It's been a minute.
I think it is a symbiotic relationship, and we need you to tell those stories about what is missing so that we can both evangelize and ask for it. Yeah. Right. So that's the intention piece. Be our partner in shifting the needle on these big problems. The other one is context, and I love the pandemic analogy here because it gives me access to stories that I can tell. But one of the great ones is in several African countries, you see Lassa fever rip through the country every year, but it tends to be a disease of young children and women, and people weren't really clear on why they were seeing that pattern. up until they sent in some ethnographers who spent 2 years doing a bit of research, something that I imagine your local journalist could have told you in a few hours from a couple of conversations, which is crime in the area was very high. People who were storing food outside in large containers started bringing food indoors at night to store it. When you bring that food indoors, what you also bring are rats that are one of the key vectors for infectious diseases like Lassa fever. And when you looked at the household structure, men would sleep on beds and women, mothers and their children would sleep on the floor, most accessible to rats. And suddenly you understand why it is that we're seeing the pattern that we're seeing, right? That local context that journalists provide is very much part of that first line of defense against the next epidemic, outbreak, pandemic. It will be the first line of defense against the impacts of climate change, and helping researchers know where to look, right? Again, it's a partnership. And I don't think we talk enough about the fact that these silos exist in much more nuanced ways than we talk about. Sometimes we think about it just in subject matter silos, where I think even professions need to recognize there is opportunity in working together.
Yeah, and I would say the third pillar to that is audience. Just to take a second to explain, I run something also called the Oxford Climate Journalism Network. Last year, we did some research around audience trends in 8 countries, including countries like the UK, India, Pakistan. And one of the things that we came away with, and that was important, is that audiences do want more news around climate change, but often they feel overwhelmed by not understanding the context of it. How big is this problem? How small is this problem? How worried should I be? What can I do? There's a lot of that coming into how they're consuming news around climate change. So let me use that as sort of the backdrop, Sondre, and ask you, if newsrooms or journalists were to say, okay, I understand, how do I sit down and do this? How do I build a model where I can understand what the impact is, and how do I equally communicate that in a way that is clear to my audience? How would you do it?
Well, first off, it's often very hard. That's part of it. But I think that there is an untapped potential here. And I think that we will see a lot more of this sort of work where you are doing kind of research as a journalist. And I think that this will happen. And there's a couple of reasons for this. One of them being that you see this sort of quantification elsewhere in society. If journalists don't provide a narrative, then others will, and that will win out, and that will be very bad, I think, in many cases, as industry and governments dominate the conversation. Now, how do you do this? There are a couple of ways, I think, that you can greatly increase your ability to do it. One is if people can share their work openly. Personally, I think you should do open source work if you can. So that's what I'm trying to do. Whenever I do something, I share my detailed methodology, I share my code, I share my data. Everyone can use it as they want. The second thing is that I find that a lot of academics actually are very receptive. They just need to be, and pardon to any academics in the audience, they just need to be given very clear instructions about what you need.
Sounds familiar.
Yes. And so one of the things that I try to do is I'll talk to them and I'll say, I'm interested in this question. This is the particular context that I'm working in. I need numbers on this. What would be your best guess? I don't need you to say, maybe it could be this, maybe it could be that. I need to say, what is your best guess and what is the range around that you think is likely? And with something like that, you can often get pretty far. Overall, though, I think there is especially an untapped space in local reporting. So the kind of work that I often tend to do is sort of these more like global things. We're an international publication. We have readers in sort of that want sort of that context. But I think in local reporting, you're seeing this more and more, and especially during the pandemic in places like India, Jakarta, and Turkey, where local journalists would actually sit down and be like, well, okay, well, these are the death counts. How do I model excess deaths? They look up a publication, they figure out how it's done. It turns out not to be that complicated. Then they do it, and then you suddenly have a number that you can refer to.
Sondre,
Do you want to jump
if I
in?
could just
Yeah.
interrupt,
Yes.
do you want to quickly explain how you did it? And what is this concept of excess deaths and how that sort of came to be the measure that we used?
Yes, of course. Sorry, I've sort of it's been in my head for a couple of years now.
It's the suit.
No, no. So what it is if you take death counts And then you look at how much, you look at that counts, and you look and you say, well, what would you expect in a normal year, and what do we actually observe? So during the pandemic, you might expect, say, 600,000 deaths in a country. Instead, you actually see 1 million. Then you have 400,000 excess deaths.
Yeah.
And so basically, you take, say, 2015 to 2019.
Yeah.
You look at the trend, and then you have a baseline. And then,
what I wanted to ask was whether you've started this process in, particular countries and what you're beginning to see. I mean, just to hark back to the point Bilal is saying, if the WHO is this much behind their figures, what is it that you've begun to track, and have you begun to track it?
you were talking about
Climate change.
Oh, climate
Yeah.
change. Yes, I think climate change is a tough one, to be
Yeah.
honest. There is a sort of a twin problem where you have this very physical reality that a lot of climate modelers are interested in,
Yeah.
where they're sort of trying to figure out what the effects of different emissions, different gases, and so on will be on temperature, on the likelihood of extreme events, and so on and so forth. But then you have, at least my interest, which is on the human outcomes. Sort of what does this mean in terms of what you see on the ground for people living in these places. We have done some work on heat waves. We did recently in India and in Europe. We're also looking at extreme cold because of the war, essentially, and what that meant for fuel prices.
Do you want to walk us through what you saw in India, for example, or even with the cold wave?
Yes, sure. So in India, it is, as you know at the moment, pretty bad.
Yeah.
And one thing that's particularly worrying is, of course, these wet bulb temperatures, where humans basically cannot survive without some sort of method of cooling themselves. Curiously, though, there is some strange interaction with pollution in some places, where pollution actually can reduce the problem, which is something we're looking into. And then in Europe, the cold wasn't as bad as expected this winter, which was very good.
Amruta, what did this mean for journalists like you in newsrooms that didn't have access to this much information, as also, I would add, the added and extremely difficult layer of policy and policymakers not being as accessible or as honest as one would like? And are you seeing that in climate change reportage as well?
Yes, absolutely. But I think for every policymaker who does not want to speak, there are 10 who are not allowed to speak and would want to get their point across to you. So I guess our jobs as journalists is also to find those people and to know, the work that is happening and to follow their work over a period of time so you know what questions to ask. And again, we're not strangers to this phenomenon in India. For the COVID-19 excess deaths, for example, the government reported less than 500,000 deaths. Yeah. And what the data actually told us eventually that it was more than 10 times that. So, when you juxtapose that with what is happening with climate change right now, specifically with heat waves, because that is something that we're literally dealing with as we speak, the number that the Indian government reported last year was ridiculously low. Yeah. And when you see what's happening on the ground, you see the number of hospitalizations, you see the number of people who cannot get to work because of heat waves. It brings me back to Bilal's question of who are the most, impacted, but who are the ones that we're not tracking. So here we're talking about daily laborers, we're talking about migrant workers, we're talking about women and children. So, and then you go back to, okay, how do policymakers think of them? And are they even, looking at that question? Or does it matter to them about who's actually just coming to the fore and what are the numbers that are being reported at that global level? So I think as local reporters, it's important for us to understand that whatever numbers that we are seeing on the ground are important, even if they don't align at that moment with what the government is putting out, with what the international agencies are putting out, because if COVID has taught us anything, it's that they catch up, eventually.
Yeah. Bilal, and this is a question more to newsrooms and especially the large media organizations that have the capability to do this. Is there enough support for journalists who are trying to tell this story in as honest a fashion as possible? Just as an example, Pakistan went through a devastating series of floods. Not the first one. There is a vicious pattern to it, again and again and again and again. But if you speak to most journalists based out of there or construct conversations around that, you'll find that 9 times out of 10, the focus of the reportage is around policy failure, which it well might be, but the fact that there is a pattern to this and that pattern equals climate change is something that goes unreported. And I hesitate to point a finger at the journalist because I'm not sure how well he or she is being supported with information or context, as you said. Any thoughts on that?
I don't think the journalists are at fault at all, and it's been part of the way that we've talked about building the field, that we recognize we are bringing two very disparate communities, the climate and health community, together to start talking about attribution science, which is a really complicated set of methods. We have not mastered the art of this. There are bits of pandemic science that we have had for 100 years. We were talking about this last night. The original paper describing the R number in a malaria outbreak is in the Wellcome collection archives, right? This is well-trodden paths that we are trying to bring into data journalism. Where it comes to climate and health, these are researchers figuring out how to do this for the first time and recognizing that a lot of the open data sets that folks have access to aren't fit for purpose. So the thing that people default to is these global reanalysis products that large institutions like the European Centre for Media and Weather Forecasting put together. And what it does is it takes meteorological station information from around the world, which is points, very hard to model with, and turns it into a beautifully gridded map where in, let's say, 100-kilometer grid squares, I can tell you the temperature every hour, right, which is great. It makes the job so much easier, but it goes back to that little slide I showed, because I can show you the exact same slide for where are the Met stations providing information for these large global reanalysis products. They're from high-income countries, right? Tufa Dinku, who's a brilliant scientist, Ethiopian by origin, but works at the University of Columbia, sat with us a few months ago and said there are more Met stations in Germany providing information to these large models than there are in the entire continent of Africa, right? So my criticism isn't going to be with any individual, but rather the fact that there is a whole bunch of research that we need to do to establish what best-in-class analysis looks like, and then figuring out how we disseminate it in a way that journalists can use it, right? It can't be hidden in a paper behind a paywall in language that is inscrutable to the common person.
Yeah.
So I think there is a challenge for researchers that we articulate to them every day, which is how do we make this more open, right? How do we share the code? But equally, what does good look like? And to answer your question, I don't think journalists get enough support. I don't think researchers are getting enough support, which is why we've been advocating for more investment in the field. But it's delightful to hear that the conversation is finally surfacing and we're recognizing that there is a challenge here that needs to be met with a degree of urgency.
Yeah. Amruta and Sondre, the question is really for both of you, and this is the important one, I think, and the other parallel to draw between COVID and climate change, which is, guess what? Neither of them respect geographical or national boundaries. They're not going to stop at the border between Italy and Spain and say, hey, now, here's where I take a pause. So how do the both of you suggest building international collaboration and support amongst journalists, especially when you're pushing back not always against a local government, but against much larger organizations? You're pointing fingers at the WHO and saying, no, I disagree with these figures. How do you do that?
You want to go first, or?
You can go. You want to start with the local? We'll start with the local and go. Yeah. I mean, I think the key is really knowing who else is working in the field and how to actually get that message across, right? And I think those lines are getting really blurred every day. Like we're just saying, we're not used to really talking about climate and health in the same breath. But here we are. This is the moment that we need to start doing it. And I think we really need to break those silos of climate journalism, health journalism, policy journalism. I think everyone is a climate journalist. Everyone needs to be a health journalist. And at the end of the day, we're all policy journalists, whether we're reporting it from the UN or our national parliaments, or looking at what impact is happening on the ground, because eventually we're talking about lives.
Yeah.
So I think really knowing who your allies are and who you can connect with and speak the same language is important, both at the local level and at the global level. I think global journalists, quote unquote, I say, have an added responsibility of, figuring out who those local journalists are, giving them credit where it's due, and also figuring out how you can work with them collaboratively rather than, taking the information that they produce and sort of using it in a broader big picture sense. Because I think, again, the lines between big picture and field reporting is also getting blurred every day.
Yeah. Sondre, are the Economist DMs open?
Yes,
Okay.
they are.
Good to know.
No, I think that's an excellent answer, and I do think I'll pick up on a few things. One is this thing about credit. I think that is absolutely crucial, actually, and the stuff that we're doing, we wouldn't be able to do if we didn't have support from local journalists, our own, but also local publications. And I think if you support and you highlight and you really celebrate good work, then you'll see more of it. So we should really do that. With regards to these global collaborations, I do think, as you say, that the people working for big international publications should, they have a special responsibility, I think, to be transparent in their methods and to give back. One of the ways that we're trying to do that is to work with organizations like Our World in Data, which we talked about yesterday, and have them essentially use our data and say, you can use it, and then from there on out, it goes out into all sorts of publications. And I think the last point I'll say is that it is crucial not just to get the sort of facts from the ground, but also what those facts mean. And I think that is something that is too frequently overlooked, where you hear a story about something happening and you say, well, this doesn't sound that bad, but then you learn, like the story about this epidemic you're talking about, that actually the spike in robberies had the follow-on effect of actually causing an epidemic because people took their food inside and so on and so forth. And I think that last part is something you can really only do if you're on the ground, if you're there.
Did you have an example of that when you were sort of in the throes of reporting around COVID, for instance?
Yes, I think there were many. So one of the things that I was very curious about was the situation in China, of course, where we tried as hard as we could to get the numbers.
And there were only single-digit figures. It was,
No, and it's just very difficult. And one of the things I remember was a bit after the initial outbreak in Wuhan, we had some people who were allowed to go back on a trip to the city, and I asked them, "Can you please go to the graveyard and take pictures of the gravestones?" Turns out they had the whole place guarded, so you couldn't get in. So I think that sort of speaks about what authoritarian governments can do in order to suppress the true tallies.
And the inherent bravery of on-ground journalists in doing that. I want to talk about, because I don't want to leave you with a heavy heart and heavy mind, I want to talk about the solutions that could present themselves in a situation like this. But before that, let me pause for a minute and do a sort of tour de table of journalists or organizations or work that you recommend for people in this room and outside to follow, that you think are doing seminal work around climate change, around health and climate, that you think all of us should follow and read. Perhaps you could start with you.
Oh, God. I think on the research side, there are brilliant groups throughout the world. I will name a few, but I will say that if you follow the Wellcome Trust, we will share a lot of them with you. You are welcome to reach out to our comms team. But on the research side, I would say folks like Sir Andrew Haynes at the London School of Hygiene and Tropical Medicine has been around for a long time. He has been a force in the field and has really advocated for the climate and health intersection. He was there back in the day when we called it planetary health as well. I would say folks like Rachel Lowe, who's now at the Barcelona Supercomputing Center, is absolutely incredible with all of her thinking around how do we use novel technology, drones, low-cost sensors to fill weather gaps in low and middle-income countries where, let's be honest, we're not going to start spending tens of millions, hundreds of millions building new meteorological services. So we need to think in a more agile way about how we fill those gaps. Antonio Gasparini at the school, who led the multi-city, multi-country collaboration, is coordinator of it, along with many other collaborators. I'm thinking of people like Matthew Chersich in South Africa, who does a lot of work on the impacts of heat on maternal, newborn, and child health. There are policy groups like Climate Works, the Thomson Reuters Institute, the WHO, Diarmaid Campbell and Joy Schumacher-Guillemot, who work at the WMO, the World Meteorological Organization as well, thinking about climate and health. I don't think, whilst I completely agree with the point that there was a lot that went wrong with how national governments, international multilateral organizations shared information and talked about the problem during the pandemic. Also, I think that to be a little bit generous to them, there are a set of perverse incentives we've created for them to not always do their jobs in the way that we'd like them to not always behave in a manner that you and I would consider trustworthy, but is necessary. And yeah, I would love to find a way to bring folks like the WHO, WMO into the fold and find a way to meaningfully work with them, because let's be honest, none of us are solving this alone, and having an enormous member state organization on our side couldn't hurt. Yeah, I'll stop there. I could ramble.
I think in India, the organization that did a lot of the excess mortality work, especially during COVID-19, and continues to do so much more in climate change, is Scroll. Again, the data journalist Rukmini first started publishing her stories on Scroll, and that's how we kind of found out what is the extent of excess mortality in specific states, and that led us to, the national number. The organization PARI, which is the People's Archive of Rural India, really gets to the core of human stories, right? And that's where these silos are being shattered literally every day, where you're like, yes, this is how health affects climate, affects policy. I think, I'll leave the audience with these two, because I think that's the core of sort of what's happening on the ground and what everyone needs to know about.
Well, there's one publication that I would like you all to read, of course, but beyond that, I think there's, at the global level, to talk about that, I think the FT and the New York Times and all these, the sort of the usual suspects are doing a lot of great work. I think people like Hannah Ritchie at Our World in Data is really good at highlighting the steps that people can personally take in order to be more climate friendly. And then on the beyond that, it gets a lot murkier, and it's kind of hard to highlight that many people. I think it depends a lot on the context you're interested in. If you're interested in climate change in your local community, which is a real thing and is sort of happening right now, then follow your local journalist.
Yeah, I would also add think tanks. I think they did quite a bit of work in the South Asian context. Places like CMIE, CPR did quite a bit of work around, especially what was happening in rural India and parts of South Asia. So let me sort of throw a couple of ideas at you and tell me if they land in terms of good solutions. The first one, and Sondre, I think you speak well to this, is that adversity prompts innovation. Do you think you would have come up with as fantastic solutions as you did if it weren't for that period in time? And do you feel, by extension, that at this point we really do have the tools that we need? We're just not using them efficiently enough to talk to climate change and death or mortality?
Short answers would be yes and yes. I think that necessity does breed innovation, and I do think it would be very hard for someone like me. I mean, coming in, I was 2 months into the job when I started doing this. It would be very hard if it wasn't a time of immediate sort of no one knows what's going on crisis. I do think the tools are not, there's no perfect sort of, oh, we used this for COVID, let's just take it and use it for climate change. But a lot of the tools, a lot of the techniques, and I think especially this questioning of numbers that are being put out by competing sources, I think is a big one. So yeah, I would say that.
Okay. Bilal, for you, the point that you made about inequality, because often it's not just exacerbated by the threat itself, but by the mitigation policies that are presented, which can often be quite skewed. Would you say then that one way to go about this is to really work hard at transparency of normative standpoints and to sort of share that with the wider journalistic community, saying, here's the bar you need to set and here's where you need to rank everyone against it?
Absolutely. And I think that with that responsibility comes a responsibility for us as an academic community to make sure that we can develop effective normative standards and describe what good looks like in terms of best-in-class research methodology applied to this problem. But no, I think that's an absolutely incredible way to frame it, which is, like I said, it's a partnership. How do we give you the tools that you need to provide a really important service that's going to be necessary if we're going to shift policy action and the eventual death toll needle of this problem?
Yeah. Amruta, perhaps the toughest one for you and how to do it, which is that broad public support is critical. You may hate and love your audience on alternate days, depending on how your story does. But ultimately, as Bilal said, no one's getting this done alone.
Yes, absolutely. And I think it also brings us to the question of trust and the trust that we can build in our audience as journalists, right? I think by questioning figures, government figures, international organization figures, just questioning the status quo is something that we have to keep doing every day. Again, the audience might hate us for it because they don't want to believe that things are as bad. We're being called alarmist every day, but this is the reality and this is what our jobs are as journalists at the end of the day.
Yeah, and I think I would just add a fourth one, which is to unite behind the science. Don't drink the toilet cleaner. Don't sniff the garlic. It didn't work for COVID. It's not going to work for climate change. I know it's not a happy topic. I certainly think when there's reason to celebrate, we must do that. As journalists sometimes, and especially with climate, you tend to go down a very dark hole. But you can't disregard what's happening in front of you. So as promised, it's now time for you and your questions. If you could raise your hand and I could point towards you and a mic will reach you. The lady in front, if we could get her a mic, please. Right up in front, the first row here. And if you could mention who the question is for.
Is it working? Yes.
Yeah.
Hi, I'm Kim Brees, and I co-created something called the self-investigation during the pandemic to support journalists to stay healthy and sane, covering dark stories. So I want to take a little flip in this, and this is for everybody, but all of you, which is, as you said, covering this is a dark road. So one of the pieces I'm missing in this conversation about an ask to newsrooms is how do you develop systems and a culture that's going to sustain journalists to sustain this work? Both those further away, but those on the ground witnessing this. So I'd like to know if you're willing to talk about what toll did it take on you, if that's relevant, and is Wellcome Trust willing to invest in this equally as well as the hard skills and all of the important things? Because this is too important. Too important. Thank you.
Thank you. Of course. Mental health. Sondre, do you want to give a quick sort of 2 months into a new job and...
I think overall it's been, I've been extremely busy, but yeah, I really don't feel like I can complain. Sitting in some London flat, the subject matter is dark, of course, and it does affect you, but yeah, I don't feel like I can complain. With regards to building culture, I think that was a very important point because internally too, there is this tendency to sort of, well, we have this government number, let's just use that, let's get it out. And there you need to be kind of militant, to be honest, and basically say, no, that is fake, or, we can't trust it. Here's what, you need to give a range, you need to say it's uncertain, you need to do all these things, because that's the only way you can actually tell the true story. And that gives you some enemies, or not enemies, but it brings you into some debates.
Amruta, for you, collateral damage and building culture in organizations.
Yeah, absolutely. I mean, it wasn't easy reporting on COVID, especially in a place like India. But I think having colleagues who support you, who understand what it actually means to be there, day in and day out reporting it, meant a lot. And I think if there's a way to codify that would be great. I know that we're not seeing it right now in newsrooms, but there's definitely lessons that we've learned and we can share from this.
I know we talked last night, Bilal, about the Wellcome Group's interest in mental health as, a building block in this. So
I'll I'll answer the question and then I'll take you on a little detour if I have 60 seconds.
Okay.
So Wellcome is incredibly interested in mental health. It's one of our 4 strategic priorities. We will be spending a lot of money on it, and Miranda Walpert, who's our Director of Mental Health, and Alan Dangle, who's our Director of Climate and Health, stand, because they both have standing desks, about 20 feet from each other in the office, and there are a lot of conversations around the intersection of climate impacts on mental health, not just eco-anxiety, as we're seeing a lot in younger people who are worried about the future of the planet and their future, but also very tangible impacts that you see when you get food insecurity. Every so often you see a spike in suicidality in Brazil, based on a large cohort study that exists there that we fund, where you can pull out the signal, because when you get a drought and farmers no longer are able to both provide for their families but also make a living, it's unsurprising that they're driven to those thoughts, right? So this is an incredibly complex problem that sees every degree of severity, and we are very invested in trying to figure out what our role is in driving research in this space. The other thing I will say more from a personal perspective is I spent the first 6 months of the pandemic, I trained as a physician, working in an A&E in the worst hit part of the UK, and it felt very similar to, I imagine, how people felt around the world, because it didn't matter if you were in London, it didn't matter if you were in Zimbabwe. We all had no idea how to treat this disease, and we were all without tools, even when surrounded by plenty. We did not figure out how to support physicians well. We did not figure out how to support allied healthcare staff well. And I suspect that the conversation does need to broaden out to, there are lots of people who are at the quote-unquote front lines of these public health emergencies that we do need to figure out how to support better. Do I have a good answer for you? No. But rest assured that many of us recognise that there's a lot to be done in the space.
A mic in the front, please.
Hi, my name is Ankur Paliwal. I'm an independent journalist in India. Incredible panel, a great conversation. One question, it's about the technicality and complexity of recording deaths as due to climate change, because now increasingly diseases like diarrhea, malaria have an increasing climate angle to them.
Yeah.
But I don't know if on the ground they are being recorded as due to climate change. It's also a question of resources in lower income countries and expertise. They might just record it as diarrhea or malaria or something else. We would probably not know that if it is a climate angle and if they should be recorded both in the diarrhea column and the climate change column. So I don't know how to get around that.
Yeah, no, great question. And it's a slippery slope, isn't it, Sondre? I mean, now it's also linked to cardiovascular diseases and unborn fetuses. How do you track this in sort of a measurable way?
Yes, it's extremely difficult. So the way that I would approach it would be through this excess death methodology, where you look at the sort of beyond what you would expect. The problem is that what you would expect is really hard to know, right? What would the world look like without climate change and without it accelerating? And the further we go on this dark path, the harder that will be. I think ultimately this will be very hard to detect in the same way as COVID was at the local level, because it is just sort of less spiky, if you will. You could see the waves with COVID, you could really just see it visually if you just plotted it over time. But for climate change, it might be more of a slow and steady increase, I'm afraid.
I think we have just enough time for one final. Oh, yeah, please, come on, jump in.
Because this is arguably my favorite topic in the world. Amruta was just chanting the 3 letters I love, which is ICD, the International Classification and Diagnostic Manual, which is arguably how we record who's dying of what where, owned by the WHO. And anyone have any ideas about how many COVID codes we had to release to be able to start counting COVID death directly? Although not perfect, high-income countries weren't doing badly. We released 2 codes, right? That's what it required. And when you go through the ICD and you ask yourself how many codes would we have to release to begin to understand what the impacts of climate change are, we don't know, but it's definitely a lot more than 2, right? Because how do you capture person is having a mental health crisis secondary to drought, which caused poor farming output, which caused food insecurity? Like, Most of those things would never even be captured in the ICD. And then you look at other things that the WHO have created, like the verbal autopsy. Where's the recognition of environmental risk factors, climate-related risk factors in the verbal autopsy? Noticeably absent. So completely take your point. It is something that requires quite a technical push. And rest assured that the former director of the Wellcome Trust is now the chief scientist at the WHO, Sir Jeremy Farrar. And it is singularly the thing that I think he's annoyed of hearing from me, but fingers crossed we'll get something done.
Excellent. I'm afraid we're completely out of time, but please feel free to reach out to these good folks through the course of the festival and have as many conversations as you'd like. I'd like to take a minute to quickly applaud what's been a fantastic conversation and really rich with all your nuance and context. Thank you very much, everyone.
You're really